So we are group 15 for informatics 171. My name is Candy. I'm Jasmine. I'm Danica. Cal. And I'm really.
Today we will be talking about the implementation of healthcare technology. We will talk about the first article called Careful Devices. Careful Devices is a design-led research project designing humane approaches to bodily self-tracking and in-home healthcare technology. It operates at the intersection of two major trends in technology and healthcare: the growing interest in gathering health data through consumer technologies and the shift towards at-home medical practices such as telemedicine. In these, the site of medical care moves into private space, and gathering health data is initiated and analyzed by doctors while being managed and possibly interpreted by patients. The limitations that come with this design is it is limited in the variety use, aesthetics, and trackability. The challenges with the data is that contemporary data practices that come with smart technologies often provide context-free information. Simply exposing the data is not the same as helping people to understand and interpret that data. The researchers created a design manifesto in order to address the challenges of the cost of technology in healthcare. They decided that their designs should be interpretive first and analytical second, that it should produce data that is thoughtful and easily interpreted and can be situated in socio-cultural and aesthetic contexts. Also, that there should be a collaboration between all parties in the design. An example they used that they believe fit their design manifesto was ovum, an ovulation tracking device that helps couples conceive. They said it was an example of a careful device because it creates data that is interpretable by the user and is also designed for the private domestic context.
The use of in-home health devices establishes a connection between a person's lived experience and medical knowledge in that it takes into account a new perspective and environment that otherwise would not be difficult or personal in a clinical setting. It builds a new humanistic connection between the medical knowledge and the arts. Ultimately, this method encourages patients to be more actively engaged in their own health and self-care.
All of Us project aims to collect health information from patients to use as a sort of database to pull from for health studies. The data is collected via surveys, electronic health records, physical measurements, blood, urine, and saliva samples, and Fitbit devices. The project aims to create a very, very large database, probably so that it is more representative of the general population. 80% of current participants are from historically underrepresented groups in biomed research.
Researchers are able to access data through applications, approvals, and downloads, and in many cases, this can be a very lengthy process. All of Us research program helps in that the data is stored on the cloud, which means it's online. They also use a passport model, which means that only verified users are able to access the data. In terms of participants, not only can they access their own data, but many of the protocols are still under development, which is more of the return of information, whether that be from the lab or from the electronic health records. In addition, there's also informed genetic counseling.
As of July 2019, 230,000 people have enrolled in All of Us, including 170,000 who have completed the core protocol. Patients are able to contribute information in a variety of ways, including surveys, EHRs, Fitbits, and physical measurements. In the future, the program plans to include linkages to other types of data sets and surveys, as well as genotyping and whole genome sequencing of patients' biological samples. This expands the knowledge of a patient's medical history and is a forefront in identifying risk factors and biomarkers and providing accurate diagnosis.
The All of Us program should provide better research which support accurate diagnosis and treatment selection. Although the studies and research begin early, their usefulness will be seen as immature. It must be able to resist from hacking. It also faces some challenges. First is that it might be hard to reach persons who live in rural areas. Another challenge is that the effect of the program, since it did not design with a formal statistical sampling method. I think All of Us is a very useful research program, and I want to be part of it one day. I think the idea of precision medicine, matching everyone's unique identity and health record to personalize a plan for individuals is amazing, and it will definitely help us live longer. It will also help doctors in other sectors to predict or change things that benefits us in the long term.
All of Us research program allows for these participants to share their health data through various surveys that they answer and through their electronic health records. And it's really interesting that they even include a section to describe how they will protect their users' privacy. And that's through removing their names and removing direct identifiers such as social security. And they would even notify you if there was a breach of data. So I just think it's interesting that they have a lot of tabs to address users' concerns.